Welcome to Central Venous Access Devices, an overview. Central venous access devices, also called central venous catheters, central lines, or CVCs, are sterile catheter systems that provide direct access to the bloodstream. Direct bloodstream access is beneficial for many kinds of procedures, including administration of medications such as chemotherapy, antibiotics, or pain medication, and delivery of fluids, electrolytes, or total parenteral nutrition for patients who cannot eat or cannot absorb nutrients through their gastrointestinal tract. Central venous access catheters also allow direct access to blood for blood sampling that does not require repeated needle sticks, hemodynamic monitoring such as measuring central venous pressure, and access for hemodialysis. First, let's talk about what a central venous access device is. A central venous access device is a catheter whose tip rests or terminates directly in the heart, the vena cava, or a vein in the central part of the body that leads directly into the vena cava, which leads directly to the heart. Common points of catheter termination include the subclavian, brachiocephalic, also called innominate, or iliac vein, the superior or inferior vena cava, or the right atrium. The venous access device may be inserted either centrally, which is through a central vein, or peripherally, which is through a peripheral vein. Access to the device is gained via either an exposed port, the tail end of the catheter that is external to or sticking out of the skin, or a subcutaneous port or pump. Central venous access devices can be inserted centrally via the jugular, subclavian, or femoral veins, or the inferior vena cava, or peripherally via the basilic, cephalic, or saphenous vein. A peripherally inserted central venous catheter is commonly called a PICC or a PICC line. Insertion of a PICC line involves accessing a peripheral vein, inserting the catheter over a guide wire, and then advancing the tip of the catheter to a central vein. Most commonly, this is the superior vena cava or the right atrium. The external portion of the catheter has an external port used for drawing blood or injecting medication or other substances. A non-tunneled centrally inserted central venous catheter is commonly called a central line or CVC. It may also be referred to as a VAD or vascular access device, which is a more generic term for many kinds of devices used to access the vascular system. Because this is a non-tunneled device, insertion involves accessing a central vein directly through the skin over the access site. The catheter is then inserted over a guide wire, and the tip of the catheter is advanced to a central vein, most commonly the superior vena cava, or the right atrium. Central venous catheters also have one or more external ports. A tunneled centrally inserted central venous catheter may also be referred to as a central line CVC or VAD. Prior to insertion of the catheter, the surgeon makes an incision at an insertion site, usually in the chest, then uses a device to create a tunnel under the skin through which the catheter is passed to reach the point where it enters a central vein. For these devices, a portion of the catheter resides under the skin and exits at a point elsewhere on the body, usually the lower chest, ending with ports that are external to the body. This configuration is more comfortable for patients who will need long-term access. A totally implantable central venous catheter, which may also be called a portacath or a metaport, includes an injection port and a catheter system. These systems may be inserted either peripherally or centrally. One end of the catheter is inserted into a vein, and the rest of the catheter is tunneled under the subcutaneous tissue. The port is inserted subcutaneously without any portion of it exiting the skin, which makes the device totally implantable. The catheter tip is advanced into a central vein or the right atrium, and the other end of the catheter is connected to the port. The port is then accessed percutaneously using a needle, where medication is injected into a reservoir within the port, and then the medication is slowly released into the bloodstream. Coders should not be confused by the term reservoir. The port contains a smaller reservoir that is part of the port, not a true reservoir. Central venous access devices are inserted via the following steps. Patient preparation involving patient positioning and sterile skin preparation, imaging guidance, usually ultrasound, to locate the target vein and guide needle insertion, venous access via insertion of a needle and advancement of a guide wire, placement of the catheter by threading it over the guide wire into a central vein, and removal of the guide wire, confirmation of the location of the catheter tip via X-ray or fluoroscopy, and securing the catheter and applying a sterile dressing. Thanks for watching. Health Information Associates is committed to providing educational products that help coders be their best. So be sure to check out the other presentations on the HIA YouTube channel, as well as our full catalog of offerings at hialearn.com. Happy coding!